Youth session, jointly hosted by the International Pharmaceutical Students Federation, IPSF, and the International Federation of Medical Students Associations, IFMSA. I am Tanushree Jain and have the pleasure to chair this session. I'm a pharmacy graduate from India and currently serving as the Program Director for WHO Bilateral Relations at IPSF, and also as the chair of the Health, Education and Literacy Working Group for the WHO Youth Council. Today's theme for the event is Youth at the Forefront of Climate Action for NCD Prevention. It reflects one of the most urgent realities of our time, that climate change is not only an environmental crisis, it is a health crisis. According to WHO, around 7 million people die each year due to climate-related factors such as air pollution. Meanwhile, the growing burden of non-communicable diseases, from cardiovascular diseases to respiratory illnesses and mental health disorders, is increasingly shaped by climate impacts. As young people, we are not just future leaders. We are already innovators, advocates, and implementers, shaping the systems that will define our shared future. Over the next 90 minutes, we'll explore how youth can drive innovation, impact, and accountability in tackling NCDs and climate change together. With this, I'm honored to introduce our distinguished panelists who bring diverse expertise from global policy, health systems, advocacy, and humanitarian action. To my left, first is Dr. Ruth Schumacher, Director of GIZ's Global Program on Pandemic Resilience and One Health, with extensive experience building resilient integrated health systems globally. Then we have Dr. Tia Collins, lead of the global NCD platform at the World Health Organization, with over 25 years of experience in global health policy and system strengthening. To my right, Ms. Kana Halej-Kodic, Vice President for External Affairs at the International Federation of Medical Students Associations, also our co-hosts, representing over 1.5 million medical students worldwide and a strong voice for innovation in medical education and meaningful youth engagement. Mr. Florian Westphal, CEO of Save the Children Germany, leading one of the world's foremost organizations protecting and empowering children in the face of global crisis, and Mr. Dion Ras, Executive Committee member of the International Association for Youth Mental Health and advisor to the Global Mental Health Action Network, advocating for youth-centered mental health solutions. Thank you to the panelists for joining us today. And let's begin with our session by setting the context. To start, we'll explore the connections between climate change, NCDs, and youth, and how we can strengthen collaboration across sectors. My first question to Dr. Tia Collins. From your experience leading the global NCD platform at WHO, what are the most critical levers for integrating climate resilience into national NCD prevention and control strategies, especially to ensure that these strategies are equitable and youth inclusive?
Yes, thank you. Thank you very much, Tarishi. And I would like to greet everyone. I'm really excited to see such a young audience. It's quite empowering, and I already feel the energy. So hopefully we will have the time to also engage with the audience and discuss all these issues. So to go back to your question, bringing together these two huge agendas of climate change and NCD strategies and policies, and also understanding the youth's important role in it, I think today's session won't be enough. So let me try just to highlight some of the good news and then perhaps highlight some of the challenges that we can together address today. The good news is that we have a high-level support. We have the frameworks to work with, whether it's sustainable development goals. You are probably familiar with that. There is a goal, health goal, which is number 3, and it's intertwined with many other goals, such as climate change, goal 11, there is partnership goal 17, 13, and 11 is healthy cities. So there is a framework that we can refer to, and particularly from the UN perspective, it's very important for us to have a mandate to work with member states and tell them that you committed to that. We also understand that there are a lot of synergies in the NCD space. Most of you are familiar with that, but let me just recap again. We had 4 high-level meetings already, and high-level meetings meaning that it's a part of the UN General Assembly. Every September there is General Assembly meeting, and once in a while there is a special session devoted to health, and particularly non-communicable diseases. So in 2011, 2014, 2018, and 2024, 2025, we had high-level meetings. What I'm getting at is that until 2018, air pollution, which is a major driver of climate change as well as a major risk factor for non-communicable diseases, wasn't recognized as a risk factor. So 2018 was a major milestone when air pollution was explicitly mentioned as a major risk factor for non-communicable diseases. And this time too, we have this 2025 declaration, which has to still be adopted, also recognizes air pollution. It's mentioned 5 or 6 times along with climate change. In terms of levers, and referring also to declarations and also understanding how we can take these global policies and frameworks and really translate it into something that's meaningful to people. This is also, that's in a way the bad news, that we are talking very high level, climate change, NCDs, and then when you ask an average person, they will tell you, this is too big and I don't want to worry about it. Probably nothing's going to happen in my lifetime. The same happens with NCDs. People are still saying, okay, it's a chronic condition, you're going to die of something, it's related to aging, so we can't do much about it. But the truth is that we can do a lot, but we really need to take manageable pieces and start addressing them. And this is where young generation comes in, because you are advocates, you are also people who have the experience of living with chronic conditions. You are researchers, you also are, there are many young professionals who are also policymakers, and it's incredible what we had in the back, the associations and youth networks that you have. You bring a lot of power. You already are a political actor. So you can do a lot in that space, and to just list several major areas where the action can be taken, it's the governance. We as WHO work with ministries of health, but youth have a broader reach to work with other sectors as well. It's incredibly important also to pay attention to vulnerable populations. Later on, I hope that we discuss this, particularly the ones who are affected by climate change because of geography and because of poverty and because of their health status. So we can dismantle that too and have a conversation about this. And then finally, data and research. So we understand what the solutions can be in every level, because every solution has to be tailored to a specific context. And so as a implementation researchers week, we can discuss again later on. I'll give you more examples. This is where young researchers particularly can step in and you can have a final say. And finally, advocacy. I think in advocacy, you don't need my advice. I've seen, and she is smiling here. Incredible. First of all, you are great people. I'm so hopeful that in the future, once your time comes, you will make a big difference, and you are already making a big difference. So thank you for that, and I truly look forward to having a wonderful session and good, engaging conversations.
Thank you so much, Tea. You mentioned the importance of youth networks, and with this, Kana, representing more than 1.5 million medical students worldwide, how do you see the next generation of healthcare professionals contributing to climate and NCD action? And how is the current medical education system responding to and integrating that contribution to prepare the future workforce?
Thank you so much, Tanushri. It's really a pleasure to be here and discuss this important topic. I would say the vision is pretty clear. So when it comes to healthcare's professional education, there are various frameworks recognized globally that are addressing various competencies of healthcare professionals. And one of ththese frameworks is, for example, CANMET framework. So the vision that how future healthcare professionals should enforce these frameworks are that they are fulfilling all the areas that are addressed as necessary competencies within the frameworks. So what does that mean in context of these specific topics? Is that we have a healthcare professional who will be able to provide clinical care, taking in consideration the context and factors of climate. That also means that we have a healthcare professional who will be able to deliver environmental-related education as well research. And also last but not least, I would say even the most important part is that we have future healthcare professionals who will be able to not only implement advocacy efforts and policies, but also lead them. Unfortunately, when I was reflecting on the current reality, so I'm a sixth-year medical student from Croatia. I'll be part of the workforce in less than a year. And I have to say that me, including most of my colleagues, we don't feel 100% ready and 100% competent to deliver healthcare that's climate-related. And when we are also reflecting on some of the studies that were done, so International Federation of Medical Student Associations actually did a survey in connection to planetary and environmental health in 2023. And some of the results that we have received is that only 60% of students, they didn't have anything related in curriculum that's related to the connection of climate and health, which is a bit concerning because it's the topic of the future. Then the ones who actually had it, again, 60% of them were not satisfied how these topics were implemented in the curriculum. But something what was common for all of them, 99% of them agreed that the topic is very important and should be part of the curriculum. But the issue is not only on the level of implementation. I think we should also reflect on the policies and how policies are addressing these issues. So this year, we were talking a lot about NCDs. There were some very important documents that were being discussed that we already mentioned. So for example, the Declaration on NCDs, also the Global Action Plan, the outcome documents of high-level meetings. But for example, when you go through these documents and try to analyze them a bit more, at least from the perspective of future healthcare professional, you see that they're recognizing the gaps. And they recognize the gaps needs to be addressed, but they're not very specific in the area who should address the gaps and how they should be addressed, especially in area of education. So we have a policy that has a clear vision, we can say, but we are lacking educational accountability. Another aspect is also faculty development. So most of our educators, they feel that they are not supported enough when it comes to delivering these complex topics. And what is the outcome that you have is, for example, I'm from the capital in Croatia, in Zagreb, so every year when there's a bit colder weather in the winter, of course, there's a spike of air pollution. And of course, you will have more people coming into emergency departments being decompensated with their chronic NCDs-related conditions. But for example, I won't be taught how to address them from the environmental aspect. I will just be taught how to address them from purely clinical aspect. Another aspect that we also need to address are the patients. So people with lived experiences, especially young people, they're often not consulted or are involved in these processes. But we can be lucky in a way because I think this session is a very good example that youth is aware of these gaps. And young people are already taking a lead to address these issues. But young people cannot take the lead and establish all of these goals alone. So we also need structural support. And last but not least, I would also like to reflect on systems overall. So this is not just about the system of education, of healthcare workforce. This is about the systems in general. Our systems are not ready to address the climate crisis, unfortunately. And we keep talking about the systems that should be ready. We are talking about the system that should be resilient. But in the end, systems should function without being resilient.
Thank you, Kana. With this, I would like to come to Ruth. GIZ's One Health program emphasizes the interconnection between people, animals, and the environment. How can this One Health approach enhance our understanding and response to NCDs in a changing climate?
Yeah, thank you so much. First of all, I would like to express my gratitude to be here because I think it's an impressive and extraordinary meeting we have. Have you had a look at the other meetings and forums? We are much younger here, and I already feel, like Thea already mentioned, the energy in the room. So I am delighted to be with you, and as I'm not that young anymore, although I feel young, so the more thank you so much for having me here to share our experiences and our approach with you. I'm heading actually a One Health pandemic and pandemic resilience global program. And we had some discussions already on One Health in some of the sessions here at the World Health Summit. And some people expressed to me, well, that is complicated. Is that really a concept which can be used in the current geopolitical climate? And I was answering, it's not a concept, it's an approach. It's an approach which is not so new, actually. It's an approach which promotes and enhances a holistic understanding of health. And I think most of you have had these experiences that human health is very closely interconnected with animal health, but also with environment health, which includes, of course, climate and air conditions, water, urban health, as Thea has already mentioned. So actually, One Health invites us all to think about health, not only looking at the health services, but thinking health in a broader way, because otherwise prevention gets really very difficult. So we look, with the One Health approach, we look at these factors, at these interconnected factors like air pollution, like nutrition, like urban conditions, improvement of urbanization. And One Health, through this cross-sectoral work, working together is a mindset, actually, raises attention to these linkages and tries to change the effects which climate change has on health. To give you maybe a concrete example to illustrate this, if we look at deforestation in the Amazonian forest, first of all, we think of climate change on a global level. But does that really interest the people on the ground? They say the global climate change, you Europeans should take care of that. You are the bigger emittents of greenhouse gases. With the deforestation and the climate change comes biodiversity loss, which has a devastating effect and impact on the quality of water, on nutrition, and thus on non-communicable diseases. So these interconnections, people on the ground start feeling them. There is climate change-induced crisis events in the same region where we have been working on fighting deforestation and raising awareness on the importance of the Amazonian forest. They have had wildfires and floodings, big floodings, which again have impact on health. There is a loss of habitat in these regions, which also has an effect, and I think we will talk about it, on mental health of the populations, of the communities on the ground. So these problems are all interconnected, and actually they are like a vicious circle. And with the One Health approach, we do not only try to analyze them, but to develop, together with the communities on the ground, solutions, and best is participatory solutions, taking the people with us. Again, why I like to be here is I think youth engagement in these measures, in driving as change agents, not only here in this forum, not only in the global international fora and conferences, but more important on the ground. You are drivers of change, and I hope we'll have more time to discuss on this. I give it, because I don't want to be too long.
Thank you, Ruth. It's so important that you emphasized on participatory solutions, and right on cue about mental health, Dion. Climate stresses increasingly affect young people's mental health, yet this is often overlooked in global NCD discussions. From your advocacy and lived experience, what priorities should guide efforts to integrate mental health into the climate NCD agenda?
Thank you so much, Tanu. That's an excellent question. I think before I give my perhaps proposal answer, I'd like to share some quick context, and that's that we know that from research, vulnerable populations like young people are those that are often found to experience the greatest impact on their mental health as a result of climate change. Now, we also know that, of course, I suppose the developmental period that they experience is very important, and we see this reflected in research where 75% of mental health disorders develop before the age of 24, and that these have very significant effects down the line with regards to physical health, young people's educational attainment, their financial means later in life. And we also know, one final thing, I suppose, is that they experience quite a lot of barriers to seeking care, like stigma, naturally not being able to afford care, unsupportive parents or caretakers, just to name a few. So again, to quickly summarize, they're a very vulnerable population, both in the sense that a large proportion of disorders develop before or during people's youth, and in the sense that their mental health is greatly affected by climate change. Now, in my eyes, these factors combined make young people, a very important group, a group that we cannot afford to overlook when it comes to talking about climate change. Now, one solution that has been mentioned in the fourth political declaration on NCDs and mental health, and also during, very much so during the HLM in late September, perhaps not in direct relation to climate change, but an important one, I think, to mention nonetheless, was the expansion of community-based mental health care services. Now, community-based care is already a very highly valuable asset, in terms of, I suppose, providing very accessible mental health care, low-threshold care to vulnerable populations. And it's, I suppose, reaching youth that traditional healthcare professionals cannot, like GPs and psychologists. And there's quite a few evidence-based examples out there, like At Ease in the Netherlands, we see Headspace in Denmark, which are both offering things like walk-in centers, where young people can receive psychological support from peer support workers, and they're also supervised by professional clinicians. And then I suppose the next step beyond the expansion of community-based mental health care services and the investment in that, if I could add something, would be to then, also mentioned in the declaration, to integrate these community-based services into primary health care through clear and efficient referral pathways, or even sharing the same building, as has been very successful in Australia, also under Headspace, and then in Canada under the integrated youth services. This essentially would allow us to have the best of both worlds, in my eyes at least, both the reach and the accessibility of community-based care and the access to professional specialized care and medications that primary healthcare affords us. Now, I guess one final addition I would make to this picture is that to ensure that this scaling up of community-based care and its integration into primary care is done as impactfully and effectively as possible, we do need to meaningfully engage young people with lived experience of mental health issues, both in developing new interventions, of course, but also in adapting existing interventions into their country's unique contexts. Because it's only really when we engage the young people that are affected by climate stress and climate anxiety and understand their needs that our interventions are as effective as they really can be. And I guess one last thing would be that to summarize all of this, I think it's very important to frame community mental health care solutions as a means to mitigate the effects of climate change. I think it might be a very interesting way of unifying these agendas beyond just talking about the effects of climate change on mental health, that we really kind of, I suppose, embed climate change language into pre-existing and cutting-edge solutions and what they might benefit, what benefits they might bring for us. Thank you.
Thank you, Dion, for emphasizing on the importance of embedding the climate language into the existing solutions so that they are more accessible to young people. Florian, children and youth are among the most vulnerable to both climate and NCD impacts. From your experience leading child-focused programs globally, what does meaningful youth participation in community-based health and climate action look like in practice?
Okay, thanks very much, and thank you also for the invitation. It's great to be here. Save the Children is a child rights organization, and that means we do like to look at the UN Conventions on the Rights of the Child of 1989, and that actually very clearly stipulates that children have a right to participate in decisions and discussions about their own fate, about their future, but also their present. And I can't really imagine any topic for which that should be more true than the climate crisis, because that clearly affects so many children right now, but it will also have a significant impact on their lives in future. So I really appreciate the fact that you're making that the focus of this discussion. And you know, when you look at the key word here is what's meaningful youth participation, right? Because I think we also have probably all seen and maybe even organized, and I wouldn't exclude Save the Children necessarily, child participation exercises, youth participation exercises, which are basically symbolic, which are kind of tick box exercises where you feel that, you know, you've put together a particular initiative and then you think like, oh yeah, we did almost like our due diligence and we spoke to a few young people, but frankly it's pretty meaningless. And I think so this point of what it means to be meaningful, that is the expectation of young people we work with. And to be honest, it's also the main challenge we have to confront and we have to meet. Because if you're really talking about empowering young people to lead on issues that really affect their own well-being and their future, that means you're also, in a way, you're drawing on their creativity, you're drawing on their local knowledge, you're drawing on their innovativeness, and frankly, compared to older people, a lot of the time also on their energy. But it also means you're really giving them a say. And I mean, you know, there's a lot of young people in this room, but I can certainly say, not being that young, that giving younger people a say is just not something that comes automatically to older generations. So we've really experimented with this and we've seen the results. So just reading up on this and preparing, a country I've never been to, unfortunately, but is Bangladesh, where, as you may know, extreme weather events, flooding, etc., which is really severely exacerbated by the climate crisis, really affects a lot of communities. And there, you really see youth-led organizations becoming very, very involved in preparing for these disasters, getting their communities ready for these disasters, in water management, health education, all kinds of things, and really playing a leading role and demanding that leading role. Or another example is, for example, in Uganda, where adolescent peer educators really play an important role when it comes to disseminating, health practices, nutritional practices, etc. Because also drawing on the fact that very often, if something is transmitted and communicated by people of the same age, children and young people it will be easier to understand for them, and they maybe also be more receptive. So there's a few things we can do to make participation meaningful. I mean, clearly training and mentoring is one of those, and I think that's ongoing, and I think that's also, frankly, fair enough, especially if we speak really about children and young people and expect them to be able to participate in environments which are often, predominantly with adults, then they have to be given the means and the experience almost to be able to deal with that. then giving them formal roles, formal mandates, as I said, no symbolic tick box, one-off participation. And very importantly, and I think this has come up a couple of times as well, really making sure that we have diverse voices around the table, because as we all know, there is no one youth. I mean, we have to make sure that diverse groups from within young people really get their seat at the table. And I want to finish just by saying, what does that actually ask of organizations like us? Because at the end of the day, that's why I'm invited here to speak about that. So the first thing is really to provide safe spaces. And I think that can sound easier than it is. I think you do really need a system in place that also, for example, allows young people who have concerns, who feel that they've been aggressed in whichever way, to really seek support and seek safety. Very important. The second one is really to be transparent about our limitations. I think we have to make sure, as an organization, especially in a context where maybe we are an international organization engaging with local youths, that we don't leave the impression that we can basically deliver on anything they want. I think it's really, really useful to be very clear and to do expectation management and to say these are our limitations. But at the same time, we also have to be flexible. If we only come in there with our strategy and our agenda and our program, well, then youth participation does indeed become a tick box exercise, because youth don't really have, if they do have a say at all, it's very, very limited. And then finally, and I think this was the most difficult one, but we have to be courageous, right? I mean, I think especially organizations like Save the Children, we can be very, very cautious. You know, sometimes we're very focused on whatever risks we may encounter. And young people, that's the strength of their participation, very often think differently and think more courageously and think around the corner. And so we have to sometimes really overcome our own limitations and pluck up the courage and to then also really follow their lead. And I think that's a little bit, hopefully, what meaningful participation means, related to the climate crisis as a huge challenge, but related to lots of other things too.
Thank you, Florian. I agree. Meaningful youth engagement, the word meaningful is actually more important than anything else, because we still unfortunately see a lot of tokenism when it comes to youth participation and children participation. And it's so important for a lot of the organizations, because as Kana also rightly mentioned, it's not us, the youth-led organizations. I think we are doing some great work, but we need the support of institutions and organizations to carry forward and put it on a global level, the kind of results that we want to see in terms of meaningful youth engagement. And the other important aspect is how to make it easier to understand and make it receptive for children and young people. A lot of the documents out there, the official ones, have so much technical I'll say jargons, I'll be bold enough to say jargons, that it's not understandable for a young person who may not have had the privilege of even a formal education to understand that. And especially for children, it's important to create content. It's important to create probably storybook for a 5-year-old kid to be able to understand a topic such as climate change. Mm-hmm. And also how to personalize it, because when we talk about climate change, it feels very distant. It's 50 years from now, it's 100 years from now, probably. But when we put human health into that, when we put animal health into that, when we tell kids that your health is getting affected right now because of what is taking place or what will take place in 50 years, that's when it personalizes the problem for not even children and young people, for everyone, about climate change and climate crisis. So we, I think, we'll now move from understanding the why of the challenge and its urgency to seeing who is affected and where youth fit into the response and what innovative practical actions can we take to drive integrated change. Kana, how can medical education evolve to prepare them for this intersectional challenge? What innovations or learning models do you see as most promising for empowering young professionals to tackle climate-related NCD challenges?
Thank you so much, Tanushree. I think that's a very good question. In my first intervention, I was complaining a lot. I was raising a lot of gaps. So now it's time to propose what are some practical solutions that we can actually give back. So as mentioned, these gaps are existing at multiple levels. So from policy level on international level to local implementation level. So I would structure possible solutions in 3 ways. So firstly, to close the policy gaps. What does that mean? The policies and frameworks that we have on global scale are frameworks that are actually implementable and frameworks that can be easily adapted to the, for example, national contexts. Secondly, also in context in education, it's really important to reflect on the standards. So there are multiple global standards, for example, WFME standards or WHO standards, so standards of recognition. So it's important when medical schools are, for example, getting recognized and accredited, that in the end, within their curriculum, they're addressing these topics. And last but not least, from this aspect, it's also important to develop global competency frameworks, so that there are competencies that are defined on global level, especially in this area where we are talking about global health workforce. So climate issues and their connection to health is not something that's happening in Brazil or, for example, in some country in Asia. It's something that's affecting all of us. And then moving to the second stage of it, which is mostly connected to the capacity building. So we have to ensure that in the end we are capacitating not only the ones who are delivering the education, so they know how to actually address these complex topics, but also to capacitate us as future healthcare professionals who will, in the end, we can say, have to deal with the burden of climate change and health-related competencies. You had a really good question, what are some innovative solutions that we have to explore? Yesterday, I was listening one of the panels. It was exactly in this room, and it was talking about the continuous development of healthcare workforce. And one of the speakers said, we cannot solve the problems of future with tools that were used yesterday. And that's something that I would definitely agree. So we definitely have to explore what are some innovations that we can bring into education, some experimental learning methods. So for example, we can use various simulation tools. Something that should be also explored are digital health tools, as well competencies that are connected to data management, for example. And last but not least, something I feel also we all agreed on in this session is the youth empowerment. So here I'm representing International Federation of Medical Student Associations, organization that's representing and gathering over 1.5 very inspiring million medical students. And most of my, I would say, knowledge and understanding of this topic actually comes from initiatives that were developed from youth, by youth. For example, you can see examples of international initiatives like pre-COP that our organization organized to capacitate youth on climate-related issues before COP starts in various aspects, including health. There are also various campaigns on international level, but there are also various activities that are very hands-on and are done by our national member organizations. Maybe it's a campaign on context of NCDs and climate that was done in Egypt, or for example, an internship program for students to directly encounter with these climate health-related issues in Brazil. So all of these stories actually are confirming that more than ever, youth is aware of the issues, and youth is already there at the front providing solutions. But what is also very important is that we need to explore how we can further support that youth, how we can support them in terms of capacitation, how we can also support them in terms of funding. That's another issue. I feel we as young people, we have time, we have a lot of ideas, but when it comes to implementing these ideas into practice, there are multiple challenges that we have to overcome. And last but not least, when we are creating solutions, let's just not bring solutions to the youth. Let's make sure that young people are actually there at the table. Let's make sure that they are consulted and they are involved in the discussions that are in the end pertaining to their future. Thank you.
Thank you, Kana. So closing the policy gaps, providing global competency frameworks, youth empowerment, and solving the funding issue. I think this session will be too short to solve these problems, but amazing innovations you mentioned about what IFMSA is doing. And I agree. I represent the International Pharmaceutical Students Federation, and I think some of the work that our member organizations are doing on the local level in terms of awareness campaigns, I will say that it's not just about awareing the youth ourselves. We are also spreading awareness about what, for example, pharmacy students can do in climate change. In fact, just last year, when we were attending the COP29 in Baku, there was a side event at the Children and Youth Pavilion that we did, which was titled, "What is a Pharmacy Student Doing at COP?" So we are actually spreading the awareness amongst people of what we can do and what we are already doing. With this, Ruth, GIZ's work on pandemic resilience and One Health governance provides valuable lessons. What elements of pandemic preparedness can be applied to strengthen climate-resilient NCD prevention and response systems?
In fact, there are a number of common findings which relate to pandemic preparedness as well as to climate change and health engagement. One I've already mentioned, that is a cross-sectoral approach. That's the only way to really solve this in a sustainable way, to move forward. I'm not going to go into that because you can call it One Health approach or intersectionality or whatever. Some people say also planetary health. I do not like to discuss about terms. So it's the mindset, in my opinion, which is most important. The second element, or the second finding, which is common in both, is that pandemics and the climate crisis are a global issue. That's why we treat it also in a global program. It's a global program which not one country can solve alone. However, we should not think that only in global policy forums we can solve this. This has to be translated down to the different levels. From the global level to the national level, country ownership is absolutely key, and they should be the drivers in their own country and not the global policymakers. And I would not stop at the national level, central level. I would like to go down on the more local community level, working with municipalities or even indigenous communities is a very valuable experience. And there you have this drive of change agents because they can see on their level directly the results. Again, a short example, what we have been doing, you have been talking about training. We have been in the Amazonian forest, worked with municipalities and indigenous communities and making them detect themselves, look with microscopes, risk factors for infections and clean water, water poisoning, etc. This has been done on the one hand with parents and teachers, training of trainers, but on the other hand, it was youth-driven by young adolescents, not younger children, it was adolescent level, and who have then been, again, bringing this back home, into their home level, into their households. And we had an impressive drop, well, this is not NCDs, this is infectious disease, in vectors, and also in some, we had some early detection of some infectious diseases in these communities, but also the water quality has improved because there have been very simple measures of them tracing down risk factors in their environment. Just as one example, the third one, the third common factor, common finding, is that there, and that's, well, my role as a head of a global program, I'm pretty close to politics, is particularly in development cooperation. And we have seen huge shifts, sometimes it's going like this, in political attention. Same thing for pandemic preparedness and response, same thing for climate change and climate policies. If you look at the current geopolitical situation, some governments putting even evidence of climate change into question again, and we face new challenges for policies which we have already thought which had been common understanding and common policies, and now they are put under threat again. So there again, I think we have to engage together, we have to communicate, we have to bring in evidence, but often evidence is not enough, to be very clear. We always think evidence-based political advisory services is a good thing. Yes, it is, but often evidence is not listened to. But communication and advocacy. And I would like to remember Fridays for Future was a glow. I was impressed. I have to say, Fridays for Future really impressed me, not only because I have 4 children, and they were all there, and also pressing at home. So but I was impressed how by a very small movement at the beginning, this became a very strong global movement, and it even changed politics at the time. I said at the time, because I have the feeling right now, you cannot keep up that momentum for a very long time. So we have to find again and again possibilities of influencing public opinion, because politics is influenced by public opinion, and to get this into the public attention and thus into the political attention. And then again, as the other speakers had already been saying, back into the policies. Talking about policies and the different levels I had been talking about, the national adaptation plans for climate are extremely important tools. 2 things we have to be very attentive about is to improve surveillance and data collection, again, to prove that our engagement is necessary, particularly for climate-sensitive diseases and NCDs. NCDs have only come into the climate discussions more recently. They were not in there. For sometimes a couple of years ago, I always got a little bit angry when they were only talking about heat mortality. So it's not only that it's much larger. Look at hypertension, how it is influenced by heat waves, etc. We could go on nutrition, etc. Important in these national adaptation plans, and I see people from very different countries here. We have a diverse public. Try to look into yours, in your country. Look in how far they have smart and cost-efficient interventions in there, which take up also youth engagement, because it's not always in there, and push for it. That participatory youth engagement is in your national adaptation plans. And then we already talked a little bit about it, scaling up those interventions which have worked already elsewhere and which have been successful, including community participation. There are some interesting plans. One I came across is in India, which is multisectorial, which promotes multisectorial action, which has integrated NCD measures, and mental health services as well, including climate change measures and digital platforms. And that's something we have to look into, I think, with digitalization and probably also with artificial intelligence. We can move this forward much quicker than before. So.
Thank you, Ruth, especially for pointing out how powerful communication and advocacy can be. And when youth are at the forefront of it, we have seen it affecting the politics, changing governments, etc. So definitely youth engagement and meaningful youth engagement at that can lead to powerful changes within the society. And with this, I would like to come to Thea. WHO emphasizes multi-sectoral collaboration for NCDs. How can partnerships across health, environment, and education sectors, particularly those led by youth, be better integrated into policy and funding frameworks?
Thank you, Tanushree. So at the World Health Organization, we distinguish between multi-sectoral and multi-stakeholder collaboration. I think I need to say this too, because often we use these terms globally interchangeably. So multi-sectoral collaboration, as you correctly pointed out, usually refers to the policy coherence agenda, making sure that all public sectors, including the environment, health, agriculture, finance, they all work together, applying the health in all policies approach. But in terms of multi-stakeholder collaboration, we usually refer to all stakeholders in health, whether it's private sector, civil society, or any other groups that are part of it, including the youth engagement, which we attribute that to multi-stakeholder engagement, just to define the terminology. I was just listening to colleagues referring to different areas of action where youth can engage, and also what the gaps are. I do what Kana was saying, I do appreciate this. And I was just thinking, first of all, we all are coming from different angles, and the United Nations is not in very good shape right now, as we all know, and we are also struggling to make sure that governments keep their commitments. They do stay accountable, and so it's a strange, difficult time. And so just to identify a first gap is the youth engagement that we're talking about. Perhaps we need to also dismantle this too and explain, like at the World Health Organization, we do have a youth council that's broadly defined, and you are very much part of it. But we also have youth that really youth, like children. It was incredible. The other day, I didn't know about this, but the other day from the executive boardroom, little kids, like 10, 11-year-olds, walked out in suits and ties. And so it was some kind of simulation. And Dr. Tedros really loves that where they're being introduced to these UN processes and negotiation processes. And it was really charming and adorable in a way, but also so encouraging. And I'm just looking at you laughing because when you're working with children, you have to be a little bit cautious. But at the same time, what a great investment to really bring children, and because then that's when they dream, they figure out what they want to do in the future, and so this is really youth. But then we have young professionals like yourselves, and this is a really different ballgame, I would say, because young professionals sometimes they're fresh from school and they have this fresh knowledge. So very often they do know more, but they may not have enough experience to reach some heights and have a seat at the table, basically. That's what we're talking about. And that shouldn't discourage you at all. But because, I mean, again, I think you keep trying, like first time may not work, but then there are so many entry points now, and sometimes it becomes really tick box that we have to have youth, at least one representative. But that's a good start. I would say that that's still a positive development, because a few years ago, like 10 years ago, we wouldn't have had this kind of session packed with young professionals. So even the UN is moving forward and making some changes. And then 3 major points. First, about the multi-sectorality and why it's so difficult, at least from the health perspective. It is difficult because, again, it's the funding issue. Every country has a sectoral funding. To get some budget for the Ministry of Health, you really need to dance around it a lot. But then imagine that you are telling other sectors that you need to have health in all your policies. You need to consider that health impact and all this. But if you don't give the line item to every ministry, whether it's the education or environment or agriculture or transportation, they don't have an incentive to do this, because nobody is a bad guy. It's just they have a plan and they need to deliver on it, and they have a budget. So that's a priority. So how are the priorities set? And the Ministry of Health, I would call it a Cinderella of the ministries. When something happens, Ministry of Health always gets pushed down, and then, particularly now with this huge military spending, health is a very difficult agenda to make this case. Another piece of difficulty in this multi-sectorality and in general for health is that we are still making the case for health. As public health people particularly, we talk about epidemiological burden, mortality, morbidity. It's not very interesting, particularly for young people, because mortality, morbidity may be down the, 10, 20, 30, 40 years from now. So health literacy is extremely low globally. It's incredible. We did this research during this COVID times, and it's amazing. I won't name countries or numbers, but people still don't wash their hands after using the toilet. And then the way they dispose diapers, better not to wash. And so health literacy is basically a little bit different from awareness and education. It's actually what you practice. And that's where we have a gap. And this is where physicians are also very important. I'm biased. I'm also a pediatrician. I keep looking at you, and I'm very biased toward the children and medical profession in general. But take even medical education. We started, I grew up in the Soviet Union. We studied social hygiene. So it incorporated everything that you can imagine, starting from how to build buildings, how to take care of the environment. And I found it quite interesting. But it wasn't, you could pass or fail. It wasn't even graded. So a lot of students, when you have so much other clinical disciplines, you just don't have the time for this kind of thing, public health in particular. So this is also something that we need to carefully look at, particularly when we are asking doctors to integrate prevention and cure, because we are asking doctors who have no time to attend to patient needs, and we are adding to it without giving them incentives or extra budget. So I think these are also why we keep talking about that. Deep down, we do know what the challenges are, because it comes down to funding, and it comes down to in the case of education, also this overlap between Ministry of Health and I'm really happy you asked this question, because in many countries, Ministry of Education and Ministry of Health Ministry of Health just takes care of the disease, but Ministry of Education has the healthcare education and trains physicians and nurses and all that. Iran is one exception, actually, where it's one ministry, which is very interesting, because they combined medical education and Ministry of Health. So this is also something to consider in terms of how we can revise the curriculum to make sure that healthcare workers actually have the knowledge of the social determinants widely, and then they address the disease and just not the prevention. So incentives and funding is extremely important. And finally, the actors. And again, to come back to our young professionals, you also need funding. This is, we were saying that, okay, you have to be at the table, you need to go to a high-level meeting, but who's going to pay for this? And that requires a dedicated budget and a commitment. So we just, again, from my perspective, maybe it's just a drop in the ocean, but what we started, it was an incentive grant for young researchers. And so we call it an incentive grant because it's not a full amount, but we're targeting young professionals who are getting their master's or PhD, PhD degrees in academic institutions. And we look at it's the second round that we issued this call for proposals. This time it was on integrated care pathways, and specifically to address the whole spectrum of NCD services through implementation research. And implementation research, a lot of people are still getting confused, but to just say in lay terms, we really are asking young professionals to go to their countries and look at these implementation barriers, because they're very context-specific in their country. I think Ruth was really explicit about this too, because global challenges, you have to really break down. You know, when you're talking about deforestation, maybe I'll think, oh, okay, I didn't know that it was linked to climate change, and how are they related to NCDs, and what is it there for me? So we have this grant program. It's been very popular because we did the first round. Now we're doing the second round. We received more than 500 applications, and it's incredible how much work is being done even in this research, but we are simply not aware of this. And when we do, we call it country capacity surveys, and it's very interesting. Only 31% of countries have a research plan or policy dedicated to NCDs, 31%. But then once we start adding, I mean, these young researchers, again, they're just a small fraction, But there is a lot also happening that even governments don't know. If somebody comes from the academic institution, a young professional, and says, oh, I need to just see now, how can we integrate mental health and NCD care at the primary care level, they may not count this as part of their big research portfolio, but we may have very interesting findings. So this is also something that we need to be aware of. And coming back to also multisectorality, one platform that we keep promoting, it's been 15 years already, to create at the president level or head of state level, multi-sectoral and multi-stakeholder coordination, committees, commissions, agencies, something that that's a council that brings whole government together for the NCD agenda. And there is a good example of the tobacco cessation programs and in general addressing tobacco through this kind of mechanism. But after 15 years, only 57% of countries are reporting having such a mechanism, and only 47% of them are budgeted and operational. So these are some of the, it sounds like little things, but they can make a big impact if they're really implemented and if they really have a dedicated budget. So in a nutshell, what we can say about improving this multisectoral collaboration and engaging with all the relevant stakeholders, there has to be a structure of incentives, and we do need to dedicate some funding. There is no other way around.
Thank you, Taya, for pointing out so many important things like the difference between multi-sectoral and multi-stakeholder. We actually had this multi-sectoral and multi-stakeholder youth professional meeting with the Global NCD platform this March, and it was amazing to see young professionals from all aspects of life come together and talk about NCDs. I'll give the floor now to Dion. You have co-developed youth participation strategies with various institutions and global networks. What can institutions learn from youth-led mental health movements about authentic engagement and accountability in policy processes?
Thank you so much, Tanu. So I worked on some youth participation strategies at WHO and at EASE, where I co-founded its sort of National Youth Council, which influences at EASE's decision-making through its board and its director, and kind of facilitates collaboration between our young peer support workers and our researchers as well. So I guess having had these experiences, I've seen firsthand and I've had experience what these kind of authentic partnerships that you name look like. I can't, of course, speak on behalf on any of those organizations, so take my words as strictly my experiences and my opinions. But I guess to go back to the question of what constitutes authentic partnerships and how we can kind of get global institutions to prioritize those more and to really foster those more, I guess I would start at that youth participation needs to be inclusive. It needs to allow authentic engagement. It's something, I guess authenticity kind of is, I guess affected or a factor in authentic engagement is the structure of the participation, regardless. And I guess that means like ensuring, I guess that was one thing that was mentioned here, it's ensuring that documents don't use technical language or very overly technical jargon. It means that when technical language is absolutely necessary for the youth participation, that young people receive something like a glossary or they receive ample explanations and definitions when it's appropriate. It also means offering, this is something that I rarely hear mentioned, but it's also offering the option of anonymizing people's names if they so wish to have them anonymized. For example, to prevent things like taboo of mental health care or mental health as a concept of affecting their lives, because some people might want to be involved, but they don't necessarily want their name out there because of the kind of personal or effects it would have on their personal lives. Things like having meetings online, of course, is also a thing. I suppose it's mentioned a bit more here and there. Having locations where we meet, where we have things like elevators and slopes. It's not always done, unfortunately, but it is very important. Having clear protocols for medical procedures as well, and protocols that are discussed informed with the young person so they can clearly state their needs. And secondly, I guess a point would be ensuring that they feel, or that young people specifically feel safe enough to participate. I guess the ethical part of that, of feeling safe enough to participate, kind of goes without saying. But what's a lot less obvious in my experience is that if you want young people to provide the most accurate information instead of what they kind of believe you want to hear, they still need to feel safe to be themselves. I guess the point behind that is that their personal lived experience is very deeply valuable, and that kind of needs to be acknowledged and treated with care. And you can only really get that, I suppose, accurate information by allowing them to be themselves. Now, authentic engagement requires that youth not just kind of have the participation, or the invitation, to participate, but are also prepared, they're empowered. I think, Florian, you mentioned this, are mentored as well, receive ample training to participate. They need to feel trusted. All of these kinds of things culminate in them feeling a lot safer and more comfortable in the environment that they are then exposed to during the youth participation. Global institutions should invest, like I said before, in mentorship, and that can also kind of be done through having separate roles like youth participation facilitators. Again, this is something I don't often see, unfortunately. Usually youth participation is kind of, I guess, hosted, it might be the word, or facilitated might be the word, by not a dedicated role, but by people that are already a part of the organization, as opposed to people with a skill set that really lends itself to youth participation. And then safeguarding procedures are very important as well. As for accountability mechanisms, they're really crucial to having effective partnerships with youth. I've kind of seen it a dozen times where, like, you get a bunch of youth together, we are consulted, we're asked for our contributions and our opinions, we might pour our hearts out because it's about lived experience very often, more often than not. And we're left often exhausted after sharing our personal experiences. And what happens after that? Radio silence. And so in that vein, it's said quite often, but I really fear that I do have to repeat it. A follow-up and evaluation, even things like metrics that are co-designed by young people for evaluation, those things are really important. One more point is, I guess, to kind of mention a few things really quickly, is that organizations need to have policies that commit to youth engagement and its evaluation. They need to have sustained budget lines. They need collaboration with senior professionals to be smoothed out, because often when youth participation is facilitated, it might be within a pre-existing organization that hasn't yet worked with young people. And then senior professionals end up asking, well, why are they here? What's the purpose of having young people here? And so those senior professionals need to understand the purpose and the added benefit of youth participation as well. I guess I could go on with a lot of things that would make, that constitute meaningful youth participation and really contribute to these authentic partnerships. But I think I'd like to end my answer on perhaps the most crucial part, which is that, as Florian very eloquently put, youth participation is not a checkbox exercise. It's not, we don't want tokenism. We really want co-creation from beginning till the end. And this kind of shared, I guess, sense of ownership really builds the trust that we as young people need, so that policies and programs really reflect what young people need. Thank you.
Thank you, Dion. Now to Florian. Based on your humanitarian experience, how can climate adaptation and NCD prevention programs be designed to be both youth-centered and context-sensitive, especially in crisis-affected or low-resource communities?
You know, as a part of my job, I've had the opportunity in the last few years to go to places like Afghanistan and Yemen, Syria. I'm going to Somalia at the end of this month. And I just want to reflect a little bit on that experience, because I think what you see a lot is that the climate crisis and its impact on, for example, extreme weather events, floods, droughts, etc., comes on top of conflict. And I think this is really a reality, not for a small group of children and youth. Another aspect in many places, Afghanistan, Yemen being two examples, they don't have a recognized government. And that actually also makes a huge difference in terms of the possibilities that exist to try and bring about change or address needs of children and youth. In both cases, those governments, and I'm not judging that politically because that's not my role, but they are basically sanctioned, more or less. So the interaction with the de facto authorities in Afghanistan or Yemen, northern Yemen, are extremely difficult to do. And the needs really that young people face in these kind of situations are overlapping. And so I think, I was kind of trying to get this together. I think NCDs are important. Actually, it's interesting when you speak to people that they are mentioned. I think also because young people obviously see how NCDs affect their older family members. So you can see it now in Gaza. A lot of the reports from Gaza, it will be also about younger people expressing concerns about their parents or grandparents because they have kidney failure or diabetes and they can't get any treatment. So I think this is, even if it's not for them immediately, but it does have an impact on them. It matters. We have a project actually in Yemen where we're trying to really integrate NCD monitoring into sort of primary healthcare delivery, and where youth volunteers really play quite a big role in deliver the palette of services. But the point I'm trying to make is I don't think that young people will necessarily single out NCDs as being the thing that they want us to focus on. I think, especially if you have then populations which are displaced, their problems and their challenges are interlinked, and it's very difficult for people to kind of separate the need for enough food, the need for clean water, adequate sanitation, healthcare, with a more NCD-specific need. So you have to, I think them together to be able to do that. And this is something where, despite many attempts, we in the larger humanitarian sector still fail, to be honest. Participation starts by really also asking young people what their problems are and what they have in mind as solutions. And again, that too, it's very easy in a displaced community with a lack of time, difficult access and everything. You're introduced to somebody who's presented to you as being the head of the community, and you kind of speak to that person, and everybody else is kind of left aside, and you think, well, this is as good a picture as we could get of the needs, but you're probably not catching the needs, and so you are actually preventing participation, because that's stage one of participation. Then if you move on, I think it's really interesting to look at the sort of different delivery models. So what are the different ways and means that we can then hopefully offer also support in a way that is open to participation. And I think a lot of community volunteer systems, etc., very often really heavily draw on young people, and I've seen that as well, where it's a mix of awareness raising on nutrition, on water, but also on key health issues. And young people do often have the motivation and the skill set to be able to do that. I think, frankly, digital platforms and digital communication are going to become more and more important. I have an example which I really like from Germany, actually, but it was for young people from Ukraine, and it was set up within days of the escalation of the conflict in Ukraine in 2022, and there was a group of young people from Germany who were able to offer in Ukrainian and Russian counseling, but low threshold. I mean, we're not talking about professional therapy, just low threshold, somebody to talk to, but you could communicate with these people via WhatsApp and other messaging apps. But there was a sort of reliability. There was a system you could depend on. It's an organization called Krisenchat who've really developed this since, and we supported them. And I thought this is, it's on the same time a means of engagement and delivering service and support that young people probably feel is more accessible, but that they can also then really shape, because obviously the people who did this for Krisenchat, not surprisingly, were also pretty young in many respects. And then the final point I just really want to emphasize, and just to really reiterate what you just said, if we're talking about extreme humanitarian situations, we are talking about children and young people who would have gone through different forms of trauma. And one of the most important places we can offer these children and young people are what we call child-friendly spaces. especially when we're really talking about children. And again, there, children can hopefully at their own speed, first of all, maybe just play and forget all the horrors that go on around them, and then maybe start to cope, and then maybe also start to share and start to verbalize what they need and what the solutions are to their problems. But to do that, you have to be really, really sensitive, because, I mean, honestly, to re-traumatize a child or young person through this is, you can engage, I think, into participation with the best of intentions. But when you're really talking to children and young people who've potentially been traumatized, it's a bit like you said, you really need to have people on board to help you do that, who know what they're doing. This is not just goodwill and the right intention. That suffices.
Thank you so much, Florian. To build on it a little bit, I believe that young people drive behavioral change. So even when it comes to NCDs and climate change, we as young people will be the ones who will be driving that change that is required in the society. Even in marketing, we learn about this particular aspect, that if we are to introduce a product in the market, then young people are the perfect audience. So before we open the floor to the audience, I would like to thank our panelists for joining us. We tried to cover as many aspects as we could about NCDs and climate change and the youth involvement in that in this panel, related to One Health aspect, related to policy, humanitarian, and mental health, about youth engagement and youth organizations driving that change. Now, usually this is the time for a question and answer round. Audience asks the question and the panelists answer. But we thought that we will switch it up a little bit, because you all sitting here are also bringing your own perspectives and experiences, and are experienced in some aspects that you can bring a lot to the table as well. So it's something like to pose a question and you bring your perspective to this. So we have heard compelling strategies from our panelists. Now it's time to hear from you. What youth-led or community-based initiatives in your regions are advancing climate-resilient NCD prevention? What do you think is an ideal? Yes, please.
There's a lady here too.
Thank you, and thank you everyone for the contributions. Pedro Barata from the European Medical Students Association. From my perspective, and we cannot talk about NCD prevention without talking about prevention. And for us to have prevention, we have to have local action. We have to have local climate action. We talked about mental health. We need playgrounds for our children to play in. We need to prevent it. We need to have spaces where people are in contact with nature. So we need greener cities. We need public transportation and faster transportation, so that people aren't stuck in traffic for 2 hours in a car, so that they can communicate with their community while they're in public transportation, so that they feel more of a sense of community overall. And I believe that for that, and we've mentioned it, we have to have youth participation. We need to have the input from children. What do they need, or what do they need? Because at least in my community and in many other communities, we are seeing less and less spaces for community overall. And there are stories in Portugal, unfortunately, of people going to a McDonald's just to play with their children. And and it's unfortunate, because, and this is, the youth has a very, very big impact in this. We have to go to our faculties, have more impact directly in our faculties, in our municipalities. We have to be part of the solution, obviously, but we also have to fight for it. And from the other side, I believe that what we need is not only the opportunities, because if we get the opportunities and go to the spots and are not able to get valuable input, our input from then on will always be disregarded. We need trainings on the topic. We need more and more facilitations, and just to capacitate the young people to give valuable input, so that when we get the opportunities, we can give our valuable input. That's it. Thank you.
Thank you so much. I really love that, because my personal favorite agenda that I got from my mentor is global advocacy to local action. So that's my favorite motto I'll say that I like to deal with, because when we are talking about global health governance and youth participation in that, then as, for example, IFMSA and IPSF, we are involved at the global level, but we also have member organizations who actually work on the grassroots level. And how do we translate that global advocacy that we are doing into the most regional and local level is something that we always deal with. It has its challenges, but at the end of the day, that is what is most important. Thank you. Anybody else? Maybe.
Thank you so much. I am Dominika Flisek. I am a medical student from Poland, Warsaw. And actually, during the last year of my medical school, we were able to, together as medical students, develop a policy paper about where a big part of this paper was actually how do we envision the medical curriculum with the proper climate competencies that are currently missing. And this allowed us to have and hold educational opportunities for medical students. It allowed us to conduct peer education classes for children in high school. And this allowed us to reach out to stakeholders to share our youth perspectives on the topic. And we also reached out to the government, but sadly, for now, there are no government-led initiatives in the area of climate action and prevention of diseases targeting medical students or healthcare professionals. So we understand the barriers of the financing possibilities and all the things that were mentioned during the panel discussion, but currently 40 to 43,000 of people die prematurely in Poland because of air pollution. So we really want to stand for the need and emphasize it as much as we can. And we really hope that when we are able to do the adjustments in the medical curriculum, and that when we can talk about building resilience healthcare systems in my country, that as medical students we will be able to be at the table and to also share our insights. Thank you so much.
Thank you. We will take two more interventions, one from you and one, yes.
Okay, hello everyone. Thank you so much. My name is Lai. I am a medical student from Iraq, and I am a part of the International Federation of Medical Students Association. So back home in Iraq, we have multiple initiatives that involve youth within the climate action and the climate change and its effect on NCDs. So how these initiatives started, it was a collaboration in between IFMSA Iraq with the WHO in Iraq. Basically what we did, something called YCAP, which was the Youth Climate Advocacy Program. Basically, they just picked a bunch of medical students where they were capacitated and trained on these topics. Then those youth, the same youth, were then involved within the One Health framework within the Ministry of Health, and they were also involved within writing the national action plans for health and climate with the WHO. So it was not just capacity building, it was actually direct application of the knowledge that they gained. Currently, we are also organizing what is called ELCOI, which is a conference of youth on climate change with the direct emphasis on climate change, again, with the effect of NCDs. So again, I think, especially coming from a third world country where policymakers are very much occupied with much bigger problems at stake, youth can be utilized to target really, really important issues of climate change, which maybe they would not affect the policymakers at the current time, but they will definitely affect the youth. If not now, then in 10 years, and if not in 10 years, then it will affect their children. So having these youth as the front runners and having them as the policymakers, I believe, is very, very important. And I'm very happy that we get to see that in my country. So yeah.
Great.
Thank you. In the interest of time, this will be our last intervention from the audience, the one who raised their hand. Yes, thank you.
Hi, my name is Amanda Rivera, she, her, hers, and I'm from the US. I'll say I'm sorry in advance, I didn't vote for this. But either way, I wanted to say one is, well, I'm a health improvement educator and a disability accommodations specialist at a cancer center. One thing I think is equitable workforce pipelines. I've been sitting through a lot of sessions, and I know in 2020 with COVID, we talked a lot about equity, but I think that word has been missing a lot, and I know that it's refreshing to be able to say it, at least for me. So, but equitable workforce pipelines, who is actually able to get a job? Are we targeting our youth at the beginning, giving them the opportunity to learn about the different types of professions? And is it their vulnerabilities within youth, right? And so do they have the money to go to school? Do they have the opportunity? Who's actually at the table when they get the jobs? The next is mentorship and meaningful work. At the end of the day, we got to eat and we have to feed ourselves and we have to clothe ourselves. And so participation is great, but we can't always do it for free, so that goes to the funding part. And then the community education and capacity building. There's really wonderful initiatives where they are, for mental health, educating barbers, because barbershop community is like really important and they're already talking about the problems, like whatever's happening in life. So if we can build capacity to where people are already have trust and where people are already going to talk about these things, then we can actually move forward. And also kind of using words that resonate with the community, not that just resonate with us. Mental health might not resonate with the community. It might be loneliness, it might be loss, it might be whatever else. So make sure that we're using the words that resonate most with them. And then finally, I wanted to say that when we're talking about youth participation, yeah, it's important, and sometimes we have one seat at the table, and that's wonderful, but I think that creates a lot of competition, and I've been sitting through a lot of talks, is like, oh, we have to make sure that we work together, we work horizontally, but when we create competition at the jump of all of this, when are we going to work together in the future? Right? Like we're already thinking, oh, well, there's only one seat, so we have to fight for it. And then when we get there, then we have to change our entire culture and mindset to be able to work together. So those are just my thoughts.
Thank you. And with this, we come towards the end of the session. Again, in the interest of time, I would like to invite all the panelists to give us some closing words about what exactly should we do as youth for meaningful youth engagement in NCD and climate action. In under a minute, please. Thank you. Ruth?
Yeah, thank you so much. Thank you so much for all of you for your examples. That was really very insightful and interesting also for me, gave me also some ideas. 2 or 3 points I would like to make for you. Do not get discouraged. It happens to me as well. I wanted to say to Diane, even as a senior policy advisor, in some meetings I thought, valuable advice, and nothing happened afterwards. So don't be discouraged. It happens to all of us. Don't give up. You are the drivers. Make alliances to have somebody who gives you the confidence you sometimes need, especially when you get frustrated. So, and be creative, because we can do, and that's what I love about technical cooperation in GIZ as well. We have some flexibility. We all have flexibility to be creative, and sometimes you can make quite interesting moves with very little money. Of course, I do agree. We need money, but it's not always money. It's sometimes also the mandate and the energy. And I think you people here, you have this energy. So I wish you good luck, and I hope to get in touch with one or the other of you in the future.
Thank you, Ruth. Tia?
Thank you. Again, I would like to echo what Ruth just said. Thank you so much for being here and for all the good work you do. It's really interesting to hear. I guess we will have some other channels to also hear more about your work. One thing I wanted to say, I picked up what Tanushi said about the marketing issue. I think we do have a branding issue of climate change and NCDs. The issues are too big. And when you start talking about these huge issues, then accountability also gets diluted, because it's like nobody's business, particularly when we say that all these challenges lie beyond the health sector. It sounds like the health sector is off the hook, which is not true. So I think as young advocates, in particular, it will be really, really helpful if you look at these issues from many different perspectives, from the experiences that you had, break them down into smaller pieces and advocate for that. HIV community back in the early 2000s was very successful because their main request was access to medicines, and they really mobilized the whole community, and after what happened after that. Similarly, for climate change, for health, for NCDs, it's extremely important to break them down into manageable pieces and advocate for that. And then you can always find someone who hears you. So that would be just my concluding remarks. Thank you.
Thank you, Taya. Dion.
Thank you so much. I think I'll speak from my own experience. I have been, well, I felt like, it might be quite rude to say this, but like a circus animal sometimes when it came to youth participation, in those one-time symbolic participation moments where I was kind of there on stage and then shoot out. And I think we need to move beyond that. We need to move towards genuine power sharing and young people genuinely having the influence to impact things. So what I would like to say is I don't want to co-sit on the sidelines. I would like to co-lead. Thank you.
Thank you, Dion. Florian?
There's lots of excellent things being said by my colleagues and by you in the crowd, and I don't really have much of an answer. I'm just looking at the question you asked. Is that really the right angle to ask how we can get youth to implement a decision that was already taken at a UN high-level meeting? So I think this is sometimes a little bit where we maybe have to kind of come around to that. It's probably not going to work very well like that. If we say, this is the agenda, these are the decisions, now we need you to help us make them true. So maybe that builds a little bit on what you're saying as well. And, I'm not saying that I'm any better at this, definitely not. But it's really then you've got to, if you want to really ensure genuine participation, you have to think it and do it from the start.
Thank you, Florian. And then Kana?
Thank you so much, Tanushree. I also agree that this panel was very inspiring. It was really a pleasure to hear wonderful perspectives, either from panelists or perspectives from the audience. And I think we can all agree that there are a lot of things and points that we should tackle, from raising awareness to building capacities to securing spaces for meaningful participation that are not tokenistic. We covered the aspect of finances. I would also add to that, for example, importance of feedback, how we can shape the youth participation without the feedback that youth can give, how this participation should actually look like. But what I think we can do today is to keep the momentum. World Health Summit is an amazing opportunity, an amazing space where various stakeholders are gathered for 3 days, have the opportunity to exchange their ideas. And I know I was asked this question, but I would actually redirect the question to the audience, because I don't think the question is what we can do as a group, but what each single one of you can do when you go back home. Either you're a student, an advocate, a youth leader, a policymaker, innovator, or representative of private sector. Because in the end, the change starts with individual steps that each of us can take. Thank you.
Great. Thank you, Kana. And as we close, a few key reflections stand out. Climate and health are inseparable, and so must be our approaches to address them. And youth engagement must go beyond participation to partnership, ensuring young voices shape the design, delivery, and accountability of health policy. And innovation thrives through collaboration between communities, systems, and generations. We, as youth, bring a lot to the table, as was discussed during the panel. We bring our expertise, our local experience, our energy, creativity, and all of that, and we are already driving change. On behalf of IPSF and IFMSA, I extend a heartfelt thanks to our panelists, our audience, and the World Health Summit for this platform. Thank you very much.